Today I am going to talk about hydrocephalus. This is a topic related to pediatrics. There are three types of hydrocephalus: congenital hydrocephalus, which is present at birth, acquired hydrocephalus that develops after birth, and normal pressure hydrocephalus usually only develops in older people. So today our main focus is on congenital hydrocephalus. Congenital hydrocephalus is when a baby is born with excess fluid in their brain. In this condition, the CSF is continuously formed inside the ventricles of the brain, but it does not get absorbed. The CSF is developed inside the lateral ventricles and travel to the third ventricle, fourth ventricle, and all around the spinal cord. It will get absorbed in the arachnoid space around the spinal canal. In hydrocephalus, the CSF is formed, but due to some obstruction, it will not be able to move to the arachnoid space. So it starts collecting inside the ventricle and increases the brain and head size. Okay, let's talk about the symptoms related to hydrocephalus. There will be an increase in head size. You can see here. Fontanelles bulging. The fontanelles in an infant, you will see they are bulging. When you touch it with your hand, you will feel it. Cranial sutures will get separated. Shiny scalp and veins are dilated. There will be a setting sun sign. So the eyeball will be like setting like a sun. So it will be on the bottom side of the eye. The child will have a irritability, vomiting and nausea, which is a sign of increased intracranial pressure. The diagnosis can be done by a transillumination, in which we shine a light on the head and you can see the veins inside and you can see the fluids inside. Then EEG, CT scan and MRI is the other methods of diagnosis. If there is too much CSF, however, it can put pressure on the brain and cause problems. In most cases, the peritoneal shunt is inserted inside the ventricles to mobilize fluid into the peritoneal cavity. A VP shunt is a narrow tube which is inserted inside the ventricles and the other end is inserted inside the peritoneal cavity. It drains the fluid from the ventricles to the peritoneal cavity in one direction. There is a valve which only allows the fluid into a one direction. Shunts are generally safe but can get infected, which is a medical emergency. Shunts tend to need replacement or adjusting from time to time. This requires another surgery. Most important, VP shunts treat hydrocephalus well. They relieve the pressure on the brain, reducing the risk of damage from the pressure. Discharge teachings include watching for increased intracranial pressure and watching for infection. The position of the baby depends on the fontanelle. If fontanelles are bulging, they are given a Fowler's position. If fontanelles are flat, they are given a supine position. They are also advised to check for an internal flushing device, which is at the back of the ear. It should be pressed as per the doctor's order because it drains the CSF. The purpose of this flushing device is to keep the patency of the tube. This tube should be flushed as directed and usually it is once in 8 hours. This ends my topic and thank you so much for listening.